Here we go with Lippy Q, our Lipedema Question of the week. This comes from Chris, it is, on Instagram. What happens when you don't remove all the lipedema fat during liposuction? Again, good question, common question. You've got to understand what's going on with lipedema. It's more than just a fat disorder, fat condition. It's not only about removing so-called all the fat. First of all, you never can get every single cell out. You are greatly removing mostly all the fat. You are thinning that layer down to an extremely thin layer very uniformly. There is lipedema, so-called fat, and normal fat admixed there, so you're doing perfect liposuction to bring that layer down. You're also releasing fibrosis. That is a huge part of things we've talked about in terms of decongesting and setting it back to its inception with things. But lipedema is not cancer. It does not behave like cancer, and it shouldn't be approached that way. It's not that if you leave a cell behind, oh my goodness, it's going to become rampant and start taking off into that area or other areas or metastasize. That is not the way lipedema behaves. So if a surgeon does something and leaves a little bit of fat there or another, don't be alarmed that, oh my God, everything's going to come back. They have greatly improved things. Yes, the more it is completely done properly and uniformly, the better results tend to be. You want to be complete with it. You want to be even with it. You want to release as much, if not all, the fibrosis. But don't think that if any lipedema is left behind at all, that it's going to go haywire. When I do liposuction, I'm always balancing removing things as complete as possible, but at the same time, getting the best cosmetic result with things too. If you approach it from, let me be just blatantly aggressive in every single patient and just strip everything, you're going to end up with disasters in a lot of patients in terms of the skin, in terms of how everything is. So you want to get the best functional and disease treatment improvement, at the same time respect cosmetic improvement too. But again, be complete, but don't think of it like you've got to remove every single cell of the lipedema, and if you don't, it's going to behave like a cancer and go to other areas.